In this video, we will discuss about thoracic inlet and thoracic outlet. As you can see in the diagram, thoracic inlet or superior aperture of thorax is narrow upper end of the thoracic cavity, which is continuous with the neck. The inlet of thorax is somewhat kidney shaped. Its transverse diameter is about 10 to 12.5 cm and anteroposterior diameter is about 5 cm. Thoracic inlet is bounded anteriorly by the upper border of manubrium sterni and posteriorly by the superior surface of the body of first thoracic vertebra. On each side, there will be first rib. With its costal cartilage. The plane of thoracic inlet is directed downwards and forwards with an obliquity of about 45 degrees. The anterior end or anterior part of the inlet is about 3.7 cm below the posterior part. Each half of the thoracic inlet is covered by a triangular membrane which is known as suprapleural membrane or Simpson's fascia. This membrane is triangular. Its apex is attached to the transverse process of 7th cervical vertebra and its base is attached to the inner border of the first rib and its costal cartilage. Morphologically, it is regarded as a flattened tendon of the scalenus minimus muscle. Thus, it is formed by scalenus minimus and endothoracic fascia. The inferior surface of the suprapleural membrane is fused with the cervical pleura, beneath which lies the apex of the lung, whereas superior surface is related with the subclavian vessels and the other structures at the root of the neck. Functionally, suprapleural membrane is rigid and do not allow the root of neck to puff up and down during respiration. We will divide structures passing through thoracic inlet into the viscera, large vessels, small vessels, nerves and muscles. Viscera include trachea, esophagus, apex of lungs and remains of the thymus. The large vessels include right brachiocephalic artery, left subclavian and left common carotid arteries, right and left brachiocephalic veins. The small vessels include right and left internal thoracic arteries, right and left superior intercostal arteries, right and left first posterior intercostal vein, as well as inferior thyroid veins. The nerves include right and left phrenic nerve, right and left vagus nerves, sympathetic trunk and first thoracic nerves. And the muscles include sternohyoid and sternothyroid muscles as well as longus colli muscle. Apart from this, some part of thoracic duct and left recurrent laryngeal nerve also passes through the thoracic inlet. Compression of the structures passing through thoracic inlet may lead to thoracic inlet syndrome. The structures may be compressed due to a cervical rib, abnormal insertion of scalenus anterior muscle, or some tumor or some mass. The important features of this thoracic inlet syndrome includes venous engorgement and edema of the face and upper limb on the affected side, diminished pulsation at the wrist due to compression of subclavian artery, paralysis of the diaphragm on the affected side due to involvement of phrenic nerve, and hoarseness of voice may be due to the compression of recurrent laryngeal nerve. In a condition called coarctation or narrowing of aorta, these posterior intercostal arteries get enlarged, and these enlarged arteries produce characteristic notching over the ribs. Thoracic outlet or inferior aperture of thorax is a broad lower end of the thorax. It is separated from the abdomen by the diaphragm. Outlet of the thorax is bounded anteriorly by the infrasternal angle, on each side by the costal margin, anteriorly infrasternal angle, on the side there is costal margin, and posteriorly by the inferior surface of the body of 12th thoracic vertebra. Outlet of the thorax is covered by the diaphragm, but there will be a separate lecture for the diaphragm, so we will not discuss the diaphragm right now.